Hello, everyone. Hope you're doing great. I'm Dr. Sarah, and today I'm going to talk about delayed speech in kids, how to take history, as well as counseling. This video is good for your OSCE exams, as well as real cases which you face in a clinic. Please keep in mind, this video is only for education purposes. Speech for the kids, like talk, it's important, one of the important milestone factors, as well as walking, crawling. All these are showing the growth of the kid, and it's very important. There are different causes which can lead to delayed speech. And I'm going to explain it all about the causes, as well as I will explain how you should ask questions to rule out the causes. And keep in mind, NACOSCE exams or any OSCE exams are just 10, 12 minutes stations, and you don't have that much time to ask all the questions. It's very important to use your time wisely and ask efficient questions. By just 2 or 3 questions, you can realize that this is the cause or this is not. If it is the cause, you should ask more questions about that cause, which you think it's the reason behind the delayed speech. And you can dig more. If it's not, just you can move on to the other cause and rule the other cause. Okay, what are the causes of delayed speech? One of them, which is very important one, is hearing loss. Usually, there are different things that affect the hearing of the kid. It can be recurrent otitis media. It can be using of antibiotic because of other diseases that they took antibiotic, like aminoglycoside, which gives ototoxicity and affect the hearing. And other medical conditions that can also lead to hearing loss, which further I will talk about more. There are some kids, they have slow development, and which is not concerning if there is no other red flags or any underlying medical condition. That's why some of kids will walk later than other kids or talk later. There's no anything that concern us, but we should keep our eyes on the kid to be sure there is nothing concerning. The other one is intellectual disability. Any other chromosomal disorder which leads to intellectual disability, like Down syndrome, fragile X, and a lot of things that can lead to intellectual disability, we should rule them out, because it affects the speech and leads to delayed speech, like fetal alcohol syndrome, all these conditions which we should rule out by asking questions. The other cause is autism, because nowadays people know about autism, they read about autism, and parents are concerning about this medical condition. Sometimes it's been over-diagnosed, but it's very important to be sure it is autism or not. We cannot just label the kid that he or she has autism. And it needs a lot of investigations. The other one is cerebral palsy, which is a medical condition in which there's a weakness of muscle movements and disorder of the movement disorder, which happens in the early ages of their childhood. And these kids usually have a history of seizure. They have muscle weaknesses. They can't crawl, they can't walk, they can't, talk properly, hear properly, It's very important to rule out that one as well. And the other one is negligence. And be sure there is no red flag of the, negligence or abuse, because negligence is a subtype of abuse. And you should be sure that there is this case, the kid which you see or examine, it's not the case of negligence, because as a physician, you have the obligation to report the case. Okay. Next stage is how you should start the station. First of all, you have 2 minutes to read the scenario, which is on the door. And after that, there is a buzzing sound and you will enter the room. Please be sure that you are polite. You would have eye contact. You would say hello first to examiner, and then you will turn to the patient, start your conversation. First, knock on the door and just enter the room, say hi to examiner, and pass your student ID or number, which they provided before the exam, and to be sure it's you. And then look at the patient and start your conversation. First of all, you should introduce yourself. For example, I would say, hello, I'm Dr. Silverman, the physician on duty today. Before we proceed, may I confirm your name and age, please? The patient will be if you're the mother of the kid or the father of the kid. It's very important. And they would say, for example, in our case, I am Mike Anderson and I'm 40. Nice to meet you, Mike. May I confirm your son? Because in the door, we know it's his daughter or son. Name and age, please. For example, we would say it's John Anderson and he's 2 years old. And say, okay, Mike, how can I help you today? He would say, doctor, I'm worried about John because he can't speak properly. Parents are like, when they have concern, if in this case or not, just all the cases, be sure you address the concern first. You cannot just jump into, questioning the patient and that's it. No, you should address the concern at the first step. It's very important. It gives the patient trust and, they can understand you're caring about them. That's why it's very important to answer their concern first. Okay. For example, he said, I'm worried he can't speak. I would say, would you please tell me more about it? What do you mean he can't speak? He would say, yeah, like he can't make sentences. He's already 2 years old. He just say, mama, dada, that's it. Okay. Then the next question is, when did you start to have this concern? Okay. Sometimes it's their like third child, second child. And with the previous kid, they didn't have this problem. For example, they would say, oh, my, daughter, my first kid or son, they could speak like properly at this age, but he cannot or she cannot. And or they would say, for example, in our scenario, the Mike would say, doctor, we were at the party and one of the guests had a kid same age as John, and he would say sentences, I want water, I don't know, I want to play, those sentences. And I go, I come, like those sentences, 2-word, 3-word sentences. In this case, you would say to parents like that, I can understand your concern. It's a valid concern. I'm glad you're here. I'll do my best to help you. Is that okay if I ask more questions to understand the situation better? He would say, yes, sure. Always reassure the patient that you want to help. And also, you should add this, that everything we are talking about here is confidential. And please feel free to talk or feel free to interrupt me and ask me a question if you want. Okay? Then he would say, thank you so much. The other thing is, he would say, how many words John is capable of using? He would say just 2-3 words. Okay. When did he start to say it? And what are those words? It's important. Just recently started to say, or it was 1 year ago, those things can help you to understand the condition better. He would say, for example, 2 words. Can he make sentences? No or yes. By paying attention to the answers, you can understand which direction you should go. Okay. He would say, no, we cannot make sentences. Understand. I can understand. Okay. The next question, Mike, is was he able to gain words or lose words? These things are very important, especially in cerebral palsy. People, like kids with the cerebral palsy, they will lose ability to learn new words or talk later by later, you know. It's very important. No, he's gaining words. Like before he would say 2 words, now he can say 5 words, 6 words. Okay, it's a good sign. Okay, the next one is, how does he communicate with you and his mom? Like, for example, he's pointing to things, or he grabs your attention when he wants something, or like he asks you or show you he wants, for example, water, or I don't know, his toy or something. Those are very important questions. First thing that we want to rule out is the hearing loss, okay? In this case, you would ask, does he have a history of, hearing problem, like any difficulty of hearing? You would say, what do you mean exactly, doctor? Let's say, okay, how would you describe this, his hearing? For example, when you call his name, is he responding? Is he looking at you? Or I would say, yes, I'm here, or responding properly, or just looking at you when you call him. I would say yes or no. Again, it's very important. Why no? The other cause will come out. Say yes. Okay, when you're at the other room, when you call him, it's very important. When there is something as a red flag, or like these questions, when they answer it and say, no, he won't do that. It's very important to manage the other question which you should ask. For example, one of the signs of autism is when you talk to them, when you call them, they don't pay attention to you. Or when they can't hear properly, they won't pay attention to you. Or for example, he would say, oh, when I'm standing at his right side, when I call his name, he's looking at me. But when I'm at his left side, when I'm calling him, he's not looking at me, or he can't hear. Usually, you have seen that, you have done it when you examine the babies. You usually rubbing your fingers beside their ears to see you grab their attention or not. It means they can hear, it's very important. And you would say, does he have any history of recurrent ear infection? The otitis media in kids can lead to, hearing loss for a long period of time. And does he have history of any antibiotic, using of antibiotics for a long time? Or what kind of antibiotic it was, and for what medical condition he took antibiotic? If there is no problem in 2-3 questions when you ask, it means there is no hearing loss. You can move on. You don't have time to ask like 6 questions just about hearing, because there are other medical conditions you should rule out. If 2-3 questions is okay, it's normal, you can pass. Okay, but I want to, explain the questions which you need to know, that if there was any red flag, you can ask more. And the other thing is, have you noticed when he's watching TV, he's keep increasing the volume, or when you decrease the volume, he got anxious, or when he's talking to you, is he shouting? Because they can't hear, they think, or the hearing is less than before, and they think elder patients, when they want to talk, they're shouting because they can't hear. They think they should shout as well. Other people can't hear it as well. And those things are very important about hearing loss. Okay, just imagine we rule out all the hearing loss questions. We will move on to the next question, which is about autism. And they love this case, and they love the questions which you ask, because as I mentioned, nowadays it's a hot topic. People read about it. Sometimes they think there is a relation between vaccination and autism. You should know how to address these concerns. First of all, you would ask, does he have a good eye contact? Usually kids with autism, they don't have eye contact properly. He would say, yes, when I'm talking to him, he's looking at me, or no, doesn't care. Okay. Does he show any emotions? Like happy, sad? Usually you can understand when the kids are happy or they are sad, but in autism, they don't show any emotions. Is he aggressive? Autism kids, because they can't talk properly, they can't show what they want, they become aggressive. The other thing is, does he play with other kids? It's very important because they want to be isolated. They don't like to play with other kids or share toys, sometimes normal kids can have the same behavior. It's not just for the autism case, it's different. It's all the time. You can see other kids, one time they want to play, they want to share their toys with others, and they want to be separated from the group. It doesn't mean they have autism. That's why I said it's been overdiagnosed. You need to refer this patient to, if you have concern about autism, you should refer them to pediatricians, a psychiatrist, psychologists to, rule out, because it's not just like 2 or 3 questions. You know what I mean? The other question is, does he do repetitive movement, like banging their heads or moving their hands like this? Those are very important, like rocking. These things are very important because they like to do that. Again, if 2 or 3 questions per question is normal, the answer was no, it's okay, he's not doing this. Don't dig more. Move to the next station and move to the next question, because it's very important to save your time. You don't have that much time. You should ask efficient questions, okay? The next one, do you have any history of autism in your family? You would say yes or no. Or does he like the things which are spinning? Like usually kids with autism, they like to sit in front of a washing machine, and when it's spinning, the clothes, they like to watch, or the fan, they love it. Okay? And one of the most critical question is, as a kid, does he have does he get nervous when he sees strangers? Because usually kids, just 6-7 months, they don't like to go be far from their parents. When you start to hug them, the strangers, they get nervous, anxious. But kids with autism, they won't get anxious. Okay, just imagine everything was normal. There was no yes to these questions. Okay, what is the next step? We have a bunch of questions, which we call it BND questions. Those are developmental questions. They can help for slow development. They can rule out mental retardation. They can rule out negligence. These questions are very, very important. That's why, as I mentioned, when you ask about hearing loss, autism, or first 4 or 5 questions to know what they mean that the kid cannot speak, okay? But if everything is okay, don't waste your time. Go to the next questions, which are very important. BND questions, the B stands for birth and pregnancy. But first of all, when you want to ask those questions, you should be sure the parents are biological parents or not, because the kid may be been adopted, and they don't know the family history. They don't know the genetic disorders that the family had. That's why it's very important. And ask, are you a biological father? His mom is his biological mother or no? Because those are very important questions. You can rule out negligence. You can rule out abuse. Kids with abuse, maybe they can't, because of the trauma, emotional trauma to them, that they won't talk, they won't communicate. It doesn't mean they have autism or they can't hear, because they have been through a lot. And it's your obligation as a doctor to find out and report this case, okay? After ruling out that is he or she a biological mother or father, okay, and directly you will ask, for example, Mark, are you John's biological father? Say yes. And is his mom biological mother? Say yes. Perfect. May I ask, how was the pregnancy of your wife, John? Did she have, it was a full-term pregnancy or no, it was preterm? How about, the way, after, she got pregnant, did she have any problem? Any history of skin rashes, fevers, any medical condition that she took medication? It's very important, because as far as you know, there are some congenital disorders that happen because of the congenital infections during pregnancy, like rubella, cytomegalovirus, or even STI, syphilis, can lead to hearing problem, microcephaly, or, those things are very important to rule out. The other thing is, was it vaginal delivery or C-section? Because sometimes by forceps, they can, a trauma to the head or other parts, that's why it's very important to rule out. What was the delivery? And also, did she have any complication during pregnancy? That she took medication or she needed like special care, the mother of the baby? Sometimes the mothers are the, parents who are present at the clinic, and you can ask them easily. But sometimes maybe your father don't remember. And always be sure that the kid is present, because you should examine the baby by yourself. It's not just the dad said something and you say, oh, okay, he has this problem. No, the kid should be present. If just the father or mother are at the clinic, ask them to bring the kid. If no, okay, next time bring the kid. Or now if you can call, ask father to bring him or her. And it's very important that you as a physician examine the kid, okay? And another thing, when the baby, like in our case, John, is born, did they tell you that he has some special features, like Down syndrome or fetal syndrome? They have a specific feature. Did they tell you that you need further investigations? Okay, and did you do all the screenings during pregnancy? And after the pregnancy, like after delivery, did they do like blood tests to check thyroid? It's very important, thyroid hormones for intellectual, it affect the kids with mother with hypothyroidism, affect them with low IQ, and many things can happen after that. It's very important. The other thing is, after delivery, did mother have any fever or discharge after delivery? Or did the baby have any skin rashes? Any any medical condition that needed resuscitation? Okay, those are very, very important. If all these were okay, normal, you can move on. Don't waste your time. Okay, and also remember to rule out STDs and any medication that mother took. Okay, the next question, the I stands for immunization. It's very important. The immunization is up to date or no, because some diseases when the kid can get and leads to anti-dilation or cerebral palsy, or it can lead to baby can get infectious disease and it affects his brain. It's very important that immunization is up to date or no. Did he have any history of hospitalization? Okay. If they say, yes, it's up to date, may I see the chart? It's up to date or no? Yes, I have it. Or you are a family doctor and you have it already. It's up to date or no? There is a answer. There can be an answer here that can be a red flag. Let's say there can be two types of negative answer. One is we don't believe in vaccination. Okay, I can understand. But may I ask, if you don't mind, always remember, be polite. When you ask question, have a good eye contact. Be polite. It's very important. May I ask, what is the reason behind why you don't believe in vaccination? I would say it may lead to autism, or I don't like it to, inject toxins or microbes to my baby. Okay. If you want, we can have another appointment in which we can discuss about vaccination. He would say, or she would say yes or no. Yes, that would be great. You will set another appointment. If no, please don't insist. Please. The autonomy of patients is very important. They can decide for themselves. Please don't say, no, you should have the appointment, or no, I should explain it to you. It's very important. No, they decide what is important for them. You just suggest, okay? You would say, okay, I won't insist, but if you want, whenever you decide or whenever you change your mind, I am here to help you. That is the key. Always when the patient, in other cases even, when they resist, please don't insist. Just offer them, okay, if you want, whenever you change your mind, I am here to help you, okay? Perfect. The thing that it can be a red flag in the baby shots, which are up to date or no, it can be, we don't have time, or I missed. No, we are moving to different cities. I can't track the vaccination. Sometimes, or I can tell you most of the times, those are the red flags for negligence. Nothing is important the kids for the parents. You know, kids are important things for their parents, you know, like they won't say, oh, we don't have time. We couldn't take him to the doctor. We don't have family doctor. Okay, you can go for walk-in clinic. And, you know, those things are red flag. When you hear those kind of answers, you should just switch to the negligence and abuse right away. Don't waste your time for other questions. Usually patients give you some clue. You should be careful. I know you're under stress. I know you can't concentrate sometimes, but please be sure that you are listening to patients perfectly. You are 100% there and you concentrate on the case, because by the answer, you can understand how you should manage the case, okay? And this is a red flag that, no, we are changing our city and all the time in province, we can't track. Or they would say, it can be normal. They move to another province, they don't have the track, but they can ask the family doctor to provide. Okay, if they said yes, I will ask my family doctor to provide. Okay, perfect. You say no, we don't have time, we couldn't. Those are red flags. Right away, switch to the question which are related to negligence. And I will explain it in a few seconds. Okay, next one is nutrition. Those are also important about the negligence, abuse, and development. Okay, how do you feed your baby? Have you exposed him to solid foods? It depends on the age. You know, these milestone questions are very, very important according to age, because we have a chart on milestone. At what age they should smile, at what age they should crawl, at what age they should sit without help, at what age they should walk without help, at what age they should start like running. Like 2 years old, they should run. They should eat with the spoon or hands, or those things are very important. Like, sometimes, remember, don't mix cultural things with the developmental. We live in Canada. It's very important to understand other cultures. We should be open to other cultures as well and respect them. Sometimes some conditions may be misunderstanding because we don't have it in our culture. It doesn't mean they don't exist. We should understand their culture. Ask, is that part of your culture or no? If something is bothering you in the answers, ask, is that part of your culture? Is it something you believe? Those are important to understand. That's why it's very important to, compare our milestone with the child. Okay. Does he run? For example, it's 2 years old. Does he make the tower with the cubes? Those things are very important. For example, he's 3 years old. He's 4 years old. Is he just, climbing the stairs or not? Those are very important according to milestone. Don't forget. The thing is, when you ask, maybe parents are vegetarians and they don't expose the baby to the, meat. And They might have B12 deficiency, and which may lead to, delayed speech as well with other conditions. It's very important. What kind of foods you have exposed John to? Like, is he taking solid food according to age? Is he eating meat or not? Is he taking vitamins? Like during, vitamin D is very important for development. Iron is very important for development. If he's like infancy, we would ask, does he take vitamin D? Like giving him all the necessary nutritions which he needs for development. That may slow the development, and which leads to delayed speech and other things, delaying everything. It's very, very important to ask. Okay. After nutrition, you would ask, what's your baby's weight and height today? Because usually the nurses will take care of them. Okay. What was the last one, the weight and height at birth? And the last visit, and also the height and weight at the birth. If you are the family doctor, you would have the chart. If no, patient would carry, like the parents should carry the chart themselves, the vaccination chart and growth chart. It's very important to ask them. If you don't have, ask them to bring it back, okay? Also ask about, you would see the growth chart. Is it above the 50 percentile, or it's below? Again, negligence, abuse, or they don't know how to feed the baby properly. They need education. The counseling part is all related to the cause. Maybe they don't know how to feed their baby. They don't know how to, use different nutritions. They don't know. They need education. It doesn't mean it's abuse. It doesn't mean it's negligence. They don't know. They should learn. And you will refer them to, nutritionist, or you will provide pamphlet, booklets to them. It's very important to educate patients. Mm-hmm. And the other thing, usually kids with pacifier will have, it leads to otitis media in some kids, which again affect the hearing. It's important to ask. The other thing, which is important for the developmental questions that we should ask, it's D, which is stand for that milestone that I mentioned. Okay, what he can do at this age, okay? Can he sit, crawl, walk, climb stairs, everything? If he said yes, or she said yes, in our case, Mike said yes, he can walk, he can climb stairs, perfect. At what age he started to do these things, okay? As well as the family history. Some patients, there's nothing wrong with the kid, just it's a genetic. They have slow development. You can see many kids that they are 4 years old and they start to speak, and they would say words, like they pronounce the words wrong, and they just it doesn't mean something is wrong with them. It's important to understand the background and family history. The father would say, yes, even I was 3 years old when I could talk properly. Or, for example, I was 2 years old when I started to walk. It also depends on the family history. The other question is very important to ask, does he have control on his urine or bowel movement? Depends on the age, okay? He's 4 years old, she's 4 years old, 5 years old, or less. Have you started potty training yet? Some kids, it's difficult for them at the beginning. They would get, anxious, they won't talk, those things, like they're human beings. We as adults, like when there is some emotional stress or something, we won't change totally. We won't talk. We will sit at the corner and just be quiet. Kids are also human, and those things can happen. And also ask about any changes in your life, any new thing that happened at your home. Those are very, very important questions, which stands for environment. I will ask and tell you more about it. If they said that she or he has a control on his urine or bowel movement, perfect. Something they would say, he had the control, but now he lost it again. Those are, questions that you should dig more. Whenever there is yes to any of these questions, you should dig more and more and more to find out the cause. Remember, time is precious. You should manage how to ask questions. Now we move to the last one, which is E, stands for environment. And we want to be sure everything at home, it's perfect. And the situation is amazing for the kid. Doesn't mean they should have tons of toys. No, they should feel safe and happy at home. It doesn't mean they should live in a mansion or something to be happy. No, again, it's very important, first of all, to ask, with whom does he live? It's just maybe he would say, it's me, I'm a single dad, in our case. We'll say, with his mom, or we are separated, or no, we are all together, 3 of us, or no, with grandparents, perfect. And with with his nanny most of the time, because it's 3 of us with the nanny, and we are working, and he's all the time with his nanny. Okay, it's very important. Who is the first caregiver? Again, that's the very critical question, because maybe he lives with mother and mom, the parents got separated, and the mom has a boyfriend, and he's abusing him or her. And in fact, the kid, they won't speak, because emotional trauma and stress that they are going through. It's very, very critical to ask. And the other important thing is, how many hours do you spend with your kid, with John? Because, many parents, nowadays we can understand parents need to work, they should provide family, and it's hard to spend time with kids. But many of kids that they can't speak, that they have delayed speech, when they've been sent to daycare school, right away they start to talk, right away they developmental milestone significantly will improve, because they're communicating. We're human beings. We need communication. They want to communicate with other kids. They want to communicate with their teachers. They start to talk. They start to communicate. And right away, we'll see, oh, there's a big change. Because it's very important for development to have communication with other people. He would say, no, it's just with his nanny. Okay, no, we don't have time to talk. Or with mom, she would say, some people are quiet. They don't know what to say in their routine life. That's why it's hard for them to communicate with the kid, how to explain. You would see people who are explaining, who are talking with their kids. The kid development, it's amazing. They speak, when they are 1.5 years, they can speak properly. You know what? Because they're communicating. The parents are spending time with them, teaching them, explaining to them. The other important thing that you should ask is he a difficult child? Sometimes the kids are aggressive, or they have some type of personality like adults, and it's hard to communicate with them. And some parents, they don't know how they should treat these kids. Like they have tantrum or something, and they don't know how to react, and they beat the kids, which is, again, you should be careful about abuse. Or they don't want to talk with the kid, or they don't know how to calm him, or calm her, to understand their needs. Again, that kid would have problem with development. They would have problem with speech. They would have delayed speech. And other question is also important. How many languages do you speak at home? Some, we live in multilingual country. Sometimes it's just one language, sometimes it's 2, sometimes it's 3 or 4. It's very, very important. Before we would say, expose the kid to different languages after 4 years, but now there's no restriction. They can be exposed to as many languages they want. But keep in mind that usually these kids were taught, like, compared to other kids, there would be a, slow growth in the, their speech, because they should gain all the informations, all the words from different languages. It would be hard for them. Sometimes if the kid has difficulty with even, starting one language, they should, usually speak with one language and know some words in the other language. If you see there is a problem, we ask parents to, if the kid cannot, because usually kids can understand and learn, but if some kids have difficulties, that's okay. We will ask the parents to expose to just one language at a time. Then, like, learning ability is different in different people, even in kids, it's different. Some kids can be exposed in 4 languages, 3 languages. Some kids, no, just 1 language. These are the part of counseling. For example, if there's a hearing loss, you would refer them. Is he ever been screened for hearing tests? By hearing tests, it's very important. When he's like the newborn will be screened, or later they will be screened. Have you done those tests? If no, you refer them for the test, and as well as ENT specialists. According to the cause, you can refer them or you can manage the case. And the other thing is, as I mentioned, the negligence and the abuse is very, very important to rule out, because in that case, you should, inform the cast right away. But you would say to parents, maybe they would get anxious or worried. No, I don't want to lose my kid. You say no, they won't take it right away. They will come and assess the home, assess you, kid, everything. It doesn't mean right away they will come and take a kid. No, but it's my obligation to report. And one of those random questions that can also affect the hearing is smoking. Does anyone smoke at home? Because it also leads to, otitis media and can affect the hearing as well. Thank you so much for watching this video. I hope you enjoyed, and I hope this video can help you in the OSCE exams as well as real cases. Thank you so much.